Initially, I thought it was anxiety because I just had a heaviness in my chest. It was, shortness of breath when I, walking around, doing my everyday things. And so I just kind of put it off as anxiety. Thought it would get better. Thought, when we came to a school break, it would get better, and it didn't. And it was significant enough that, it led me to obviously going to see about it. So I ended up in an urgent care thinking it's anxiety. I'm going to be just fine. They're going to send me home. And then ended up in the ER and ended up in the cardiologist's office a week later. My father passed away at the age of 47 because of valve disease. And so, yes, I think that my issues were, genetic. My mitral valve was, I don't know medically what you would say, but it was not working at all. It was not closing properly. I had severe mitral valve regurgitation. So the blood was going back and forth in and out of my valves, which was causing a lot of the issue. And it was not something that they felt like they could fix with medication. It was way beyond that. And so, initially that's what I was told was going to need to be fixed. Dr. Luke told me in his office that day, that I would need surgery and he would really like for me to have it here. Initially I was not thinking that way. I'd never really had, anybody or knew anybody that had any heart, surgeries here, any heart issues here. So I initially thought, no, I've got to go somewhere else, somewhere to a bigger hospital, and ended up, going ahead and having a heart cath done here at South Georgia Medical Center. And that's when I met Dr. Brown. He came in with his nurse practitioner and spent some time with us. And it was 6:30 at night. He had just left his office and spent some time with us and talked to us a little bit about what was going on, what he saw. He had already looked at my echocardiogram from Dr. Luke. He had talked with Dr. Luke multiple times about what was going on with me and was able to tell me what we could do to fix it. I felt just naturally comfortable with the two of them. I felt a sense about the kind of care I thought I was going to get if I stayed here, and that was comforting to me. These were people that were in my community, and I just, I felt like they would have my back.
When you have heart disease and somebody walks in and goes, "You got to have heart surgery," they scared. They go into a grieving period. They need somebody. They need some confidence that who's taking care of them knows what they're doing and cares that they get better. And that's the most important part of the entire program. You agree?
I agree. I had open heart surgery and I had a mitral valve replacement. And in the surgery, Dr. Brown had to go in and do some things with my left ventricle. He had looked at pictures of my heart and had noticed the structure of my ventricle and that my left ventricle wall was very thin. And so because he saw that, they were concerned about what could happen when they, repressurized and everything was, the pressure was being added on. So he thought that I might have some difficulty and that, my left ventricle a hole could, blow in it because of the pressure, and that did happen. So I had he repaired that with, I think, a bridge.
That's right.
Procedure, reinforced that, and I also had an ablation due to some AFib that I was having at the time. And after my surgery was over, of course he came out to talk to my family, but the fact that he sat down and explained to my family and referenced, that I was fixed, that he fixed me and that I was not going to have the same issues that my father had, and that meant so much to my family. Just to hear that from him. To even, the fact that he even remembered that. I mean, I saw him every day, multiple times a day, but then I also saw in turn the nurse practitioners multiple times a day. And you felt like you could ask questions. And I'm gonna tell you something about Dr. Brown. Just like I said about the staff and the team up there, when he's with you, you do feel like you're the most important person in the room. And he treats everybody that way. You talk to anybody that's had any kind of contact with him or his staff, and that's how you're treated. You leave there feeling like that you're cared about. And that's half the battle. I mean, when you're going through a surgery that's significant, and you know that what's going to have to happen in order for you to get better. You need to have that feeling of security and confidence to know that you're going to be okay and you're going to get through this. And that's what they give you. I mean, it's been almost 2.5 years since I had my heart surgery, and I still feel that way. I just was in Dr. Brown's office about a month and a half ago just for a follow-up, just, for him to just tell me, I've looked at your last echo and everything's A-okay. And I tell him that all the time. He said, it looked perfect. I said, I love it when you say that. I like to hear you say it looked perfect. We joke and, I'm Katie 2.0 because I actually have oxygen that goes all the way to my brain. I just spent the last 2 days walking around a golf course and, was able to walk up and down hills and to do it and not, have to stop and sit down and, watch my daughter play in a state golf tournament. So that's important to me to be able to keep up and do, I'm an elementary school principal, I'm chasing kids all day long. So to be able to do that with confidence that I can is important. So I'm a completely different person today than I was.
When I look at Katie, I look at a success of the entire team, the service line, the hundreds of people, literally, from the operating room, the cath lab, cardiac rehab, the ICU, the step down folks. Okay. If they had not paid attention to the details, nothing that I would have done would have worked. And that's what I think is important.
Well, he knows how I feel. I tell him every time I see him. I'm so grateful to him. Just his staff and just, he saved my life. And, it's not just a job to him. I mean, I know he had a job to do and he went in and he did it well. But he saved my life. You gave you gave me to my family, and gave me years that I may not have had I not met you. And I'm so grateful to you and your nurses. Just the way that they treat people, and that's the thing. You're in the people business, and you treat people the way that they need to be treated, and it's so much more than just fixing their heart. I mean, you care about people.